My name is Dr. Suzanne Humphreys. I'm a medical doctor. My specialty is internal medicine and nephrology, which is kidney specialty. And over the past 3 to 4 years, I have moved more towards a holistic orientation with an emphasis on the study of vaccination efficacy and safety and necessity.
Dr. Humphreys, when you first began practicing medicine, what were your views on vaccinations and vaccines in general, and how have they evolved or changed, and what are they today?
Today, I am anti-vaccine. However, 10 years ago, I was not anti-vaccine. I was agnostic about vaccines. I was raised up medically in a system that loved vaccines and that has faith in vaccination. I've written many orders for vaccines. I've received vaccines growing up. I received them before medical school. And frankly, I never thought about them all that much because we're not taught about what's in vaccines in medical school. We're not really taught anything about the downside of vaccines in medical school. We're given the schedule for pediatric vaccinations and told when they're due, and we administer them, which is what I did rotating through my pediatric rotation, really not thinking about it at all, never asking patients when their last vaccine was when they would present with a problem. And given that vaccines are actually drugs that have lots of chemicals and impact on the immune system, we really should be asking that. So it wasn't until later in my career that I began asking those questions after I started noticing certain things happen. And that's when I started doing my research, and I moved from agnostic to someone who questions the necessity of vaccination in this day and age where we are today.
Do you think vaccines are safe?
Well, the reason I say that I don't believe that there's guarantee for safety with vaccination has to do with where vaccines originate, what is in them, and the lack of studies that we have comparing vaccinated individuals to unvaccinated individuals. And the reason most of us have faith and don't question vaccines is because we've all been vaccinated, because we don't have a look at a group that's been completely unvaccinated. And it wasn't until I actually had experience with a group of people, children, who were totally unvaccinated, that I started to see that what we expect as childhood illnesses and as all the things that happen as we age has something to do with vaccination, because that was the only thing that was different about these children that I met about 4 years ago. I've never seen such healthy children. They did get whooping cough, they did get chicken pox, they had the normal childhood illnesses, but they never required antibiotics. They were never sick for longer than 24 to 48 hours. They were brighter, smarter. It was like talking to aliens after seeing and meeting unvaccinated children. And that's one of the things that got me to really start investigating further, was when I noticed that difference. And I think most doctors and people like you don't have the opportunity to really appreciate the difference between a vaccinated and an unvaccinated person, let alone populations. What we need is a study that actually looks at these vaccinated and unvaccinated populations, and that study hasn't been done. And whenever you want to test any drug to see what the effects are, negative or positive, you need to compare vaccinated and unvaccinated individuals. And if you want to know the long-term effects or downside or upside of the intervention, you have to follow people out for a long period of time. That's never been done with any vaccine. If you think about what's in a vaccine, which most people actually don't think about because they don't know, because it's really not advertised to doctors, it's not advertised to people who are recipients, potential recipients of vaccines. Once you start to look at how a vaccine is made and what's in it, questions have to arise as what could possibly go wrong here that we're not picking up in later years, because some of these issues take weeks, months, or years to develop. Okay? So in order to make a vaccine, you have to first obtain the virus or a toxin from the bacteria or a piece of the bacterial cell wall. So you first have to extract disease from an animal or a human. So for instance, with measles, they got blood of somebody who had measles, and they incubated that through a series of cell lines, because you can't just inject live measles into a person. You first have to do what they call attenuating it, which is to make it less virulent. So in order to do that, you pass it through different cell lines. So some of the cell lines that they pass this measles through are human cells, amniotic cells of human beings, chicken cells, monkey kidney cells. Okay, so that's what they do after they get the original virus. They have to pass it through to attenuate it. Then after they do that, they have to multiply it so that they can make massive amounts of vaccine. In order to multiply it, they'll multiply it on all different kinds of cells, like something called a Maiden-Darby kidney. This isn't for measles, but for flu shots, for instance, Maiden-Darby kidney cells, which are Cocker Spaniel kidney cells that have been made tumorigenic so that they multiply rapidly. Now, part of those cells go into the vaccinee. Fibroblasts from fetal lung cells, which came from an abortion in 1966, are some of the other cells that these vaccine cultures are grown on. There's a myriad of monkey kidney cells are still used today, and they've been used for a very long time. So all of these things, all of these animal cells, animal DNA, are part and parcel with a vaccine, and it's even listed on some of the package inserts. So you can imagine that different diseases can be picked up along the way, and that has happened in the past. There have been monkey viruses that were finally, after 30 years, acknowledged to have been causing tumors in human beings, been heavily associated with tumors in human beings. Simian virus 40, if anyone looks that up, it's all over the medical literature. This is not occult science. In addition to that, there are various unknowns that can't be picked up during testing, because if you don't know something is in a vaccine, you can't test for it. You have to have a specific test developed to detect any sort of unknown viruses. And things have been found by third parties. Viruses, stray viruses, have been found by third parties in vaccines. So there is a lot that we don't know that happens with vaccines. So say somebody gets a vaccine and they develop a viral illness afterwards, or tumors afterwards. Can we guarantee that person that the vaccine didn't cause that? No, we can't guarantee it. But most doctors in the medical profession and most lay people will never make any connection between the two things. And there haven't been any studies to really assess the difference in cancer rates between vaccinated and unvaccinated. But we do know that cancer rates have gone up as as the practice of vaccination has grown. We do know that. In addition to any kind of stray viruses that come from animals and animal cells and animal DNA, there are all sorts of chemicals that come along with vaccines. Formaldehyde, which is a known toxin and carcinogen. There still is mercury in vaccines, and there was a lot of mercury in vaccines before they removed it, but there's still trace amounts of mercury in some pediatric vaccines, and there's still mercury in the multi-dose flu shots.
Are there any things in vaccinations that are beneficial or necessary for good health?
Well, I believe that people should maintain the right to have vaccines if they want them. What concerns me most about the practice of vaccination is that people who don't want them are losing their rights to refuse them, and that there are more and more vaccines being recommended to children and to adults all the time. When I was growing up, there were about 6 vaccines in the schedule. Now there are about 32 vaccines in the schedule. When I was growing up, we didn't get our first vaccines until we were around kindergarten age. Now infants are getting their first vaccine when they're hours old. When I was growing up, adults didn't get vaccines routinely and regularly. But now adults are being recommended to get influenza vaccines, whooping cough vaccines, and measles vaccines. So the more vaccines we use, ironically, the more vaccines we need. Because what happens is we lose the natural immunity. For instance, with measles, people would develop long-term immunity for up to 75 years. There are studies that were done in the Faroe Islands that showed that once somebody had measles, they stayed immune for 75 years. It's a long time to stay immune. With a vaccination, the kind of immunity that's provoked is not the same as when you develop a natural disease, and it doesn't last as long. Okay, so if you vaccinate a little girl for measles, she may stay immune to measles for 20 to 30 years. But when she goes to have her first baby, she's not going to be passing her immunity onto that baby the same and as well as she would have had she had the natural disease, because vaccines don't impart the mucosal immunity. So her breast milk won't be as full of protection as it would have been. This is proven in science medical literature as well. I've written about it, and it's in conventional medical literature, that vaccinated women do not impart the same degree of benefit to their infants as women who have had the natural disease. In addition to that, both her child and she will not maintain long-term immunity because we don't have measles around circulating anymore, because part of the herd immunity that was happening, where the term herd immunity was coined, had to do with measles. It had to do with the percentage of people who had measles and were immune to it. And it had to do with the circulation, the ongoing circulation of that virus in the community, which was actually beneficial to adults because they were re-exposed over and over. The same with whooping cough, the same with chicken pox. Okay, look at chicken pox today. Chicken pox, most people know of chicken pox as a pretty benign entity. Now we're vaccinating for chickenpox, and hey, the vaccine's working. We're not seeing as much chickenpox, right? So that seems like a good thing. However, what we're seeing more of now is shingles, because those of us adults who need to be exposed to ongoing chickenpox through children aren't, so we're not getting those natural boosters. And so what happens is our immunity level starts to drop, and the virus can come out our spinal cord and give us shingles, which is basically, it's very painful pustules in a specific area on the skin. This is happening both in children and in adults now. I don't think this is an overall benefit. There are many countries who have refused the very vaccines that we're giving in the United States. So there are other countries who actually agree with me, and their policies are in line with my thinking, that there are too many vaccines too early, and that there's no end in sight to how many vaccines people are going to be recommended to have. Because the more acceptance people have and the more fear they have about disease, and the less they know about what they can actually do for these various diseases, which there is a lot we can do and a lot we know about today that actually promotes health, the more of a problem it is. There's no possible way that injecting animal matter, live viruses, and toxins, as well as chemicals, formaldehyde, aluminum, actually promotes health. This is not a holistic practice. Anyone would have to agree to that. There's nothing biochemically or medically necessary about anything that's in a vaccine. It does not fortify us. Vitamin D does, vitamin C does, good nutrition does, good hand washing does, getting sleep and getting adequate nutrition all benefit us and fortify us. And all of those things are what contributed to the decrease in mortality of the supposed vaccine-preventable diseases before these vaccines were ever invented. And what most people are unaware of is that the mortality for diseases like measles and whooping cough was down almost 100% before the vaccines even came on the scene in the developed world. That's pretty startling. Now imagine if somebody invented a drug that decreased mortality by nearly 100% for any disease. That would be a pretty big deal, wouldn't it? You would hear about it all the time, but yet we don't hear about how hygiene and nutrition is really what prolonged our life expectancy and made us healthier as humanity after the 1800s, when we really hit a big pothole as far as sickness and disease went. I think that's a major big deal that needs more focus. But when these vaccine campaigns are initiated, we never hear about vitamin D and hand washing and even fermented foods that contain isoflavones that can actually have benefited and documented effectiveness in polio prevention. Why aren't we hearing about this with the hype? All we're hearing about is scaring the population and getting them off to get their flu shots because we're running out of supplies. I don't believe any of that's true. I've investigated that. I've investigated the data on prevention of these diseases, especially influenza with the flu shots. I don't think the data is there. There are other professionals that agree with me. Dr. Thomas Jefferson, who heads the Cochrane Collaborative Research Database on influenza, also agrees with me. He has been outspoken about how the pharmaceutical industry and policies are really hyping up the danger of influenza and the effectiveness of these vaccines. But you would never know that by listening to the television or reading the newspaper. And I'm quite concerned about the publicity that vaccinations are getting, because it's not balanced and the science isn't there, because we've never done a vaccinated unvaccinated study, because we haven't done, even vaccine studies that are done properly don't follow people out long enough beyond 4 weeks. Most of them it's 24 to 48 hours. They're not looking for the right things. They're not using just one vaccine. We have to look at necessity. We have to look at effectiveness. And what effectiveness means is not just does it stimulate an antibody in our systems. That is almost always how trials are done, however. It's just to look at how much antibody is stimulated in our systems after we're injected with the vaccine, and what kind of titer, usually around 1 to 4, is considered immune for various viruses. In order to really know if a vaccine is effective, we would have to intentionally expose the vaccinee to the virus and see if they became ill. We would also have to know whether that person was already immune to that particular virus or not. Because say I'm already immune to chickenpox or to the flu. whatever strain is circulating, and you give me a vaccine and I don't get sick. Well, we don't know if I didn't get sick because I was already immune because I've contacted it naturally in the past and perhaps had a subclinical case, which does happen with measles, with chickenpox, with influenza, or whether the vaccine actually had that much of an effect that prevented me from becoming ill. We don't have studies like that. We just have studies that look at the antibody generation after a particular injection. Now, the other problem is that the influenza virus is an RNA virus, and it's a very unstable virus, which is why we have to every year go and create a new vaccine that has different strains in it, because there's all this strain shifting. There's drifting and shifting, which are two different things. But just to say that it's an unstable genetic makeup that changes. And so if you don't have an exact match in your immunity, in your immune system from that vaccine, then you can't say that that vaccine actually helped you. So say we vaccinated the entire population, well, how many of them actually were prevented from getting the circulating strains? Well, we don't really know that, but they have taken some look at this. In order to take a look at it, you would have to basically get a viral culture from a person who becomes ill and verify that it is influenza A or influenza B and what strain it is, and then to see if it actually is a strain that matches the vaccine that the person received. And they find that it's actually a fairly low percentage of matches that happen when those studies are done, somewhere around 13%. So can we really, now looking at that, can we say that we have 99% effectiveness if there's kind of a wild card in strain matching and strain shifting? No, we can't. But what's more important to me is that the focus has long been on giving vaccines to prevent disease. When there are so many, and like I said before, a vaccine does not fortify our immune system. It stimulates the immune system, but it doesn't make it healthier, smarter, or stronger. It basically makes it have to work harder so that it can't be doing other things in the meantime. There was a study that came out in 2012 by an author named Cowling, C-O-W-L-I-N-G. And they used a true placebo in this study, a saline placebo, and they vaccinated half of the people and they didn't vaccinate the other half of the people. They found that there was no difference in the contraction of influenza between the groups, and they found that the vaccinated group had a 5 to 6 times higher rate of non-influenza viral illnesses. Why could that possibly be? Well, we know why that could be. There have been theories written about how immunity works since the 1940s and 1950s. One of the theories has been coined original antigenic sin. What that means is that your first exposure to a virus leads you to respond to that particular virus, so that if you're exposed to another virus that's similar to it, you won't fully respond to that second virus. We saw this happen in the swine flu pandemic year, where people were more susceptible to the swine flu who had had the seasonal flu vaccine the year before. That's also documented. There are so many unknowns about the immune system, but we do see in this study that there were more non-influenza viral infections in the people who got vaccinated. So what happened to their immune systems? Did they develop enough antibody? Well, they probably did, but it didn't protect them. Why didn't it protect them? Those kind of studies need to be done, because the viruses that they contracted, Coxsackie virus, echovirus, these are viruses that are pretty nasty that we don't have vaccines for, and that back during the polio days were responsible for part of the paralysis that we were seeing that was called polio, that actually wasn't caused by polio viruses. These are questions that need to be answered, because vaccines have other effects. They do have downside, and there's still so much we don't know about the immune system. The immunology literature admits that we barely know the tip of the iceberg about how the human immune system actually works. It involves cascades of T cells and B cells and antibody generation, but antibody generation is actually what happens at the end of an infection. What happens, the first line of defense for all of us, the reason we don't die from every infection we have, is because we were endowed with an innate immune system. This is the part of the immune system that vaccines don't provide, which is it's basically the immune system that our thymus was educated in, and over and over and over as we've survived exposure in the environment. Those are the cells that are ready and waiting to attack, the ones that don't have to be trained. That's a powerful part of our immune system that's significantly overlooked. That part of our immune system requires vitamin C. I believe that most people are walking around in a subclinical state of scurvy because the recommended daily allowances for vitamin C is only 90 milligrams per day. That's not enough when you consider what we're exposed to in this day and age. If you smoke one cigarette, that utilizes about 50 milligrams of vitamin C. So that should tell you that most people, just what we're breathing, what we're eating, what we're having to process, because vitamin C does so much detoxification and supports our immune system, that we're not getting enough. So if we just look at that, like, why aren't scientists looking at that and advertising that? Well, how much money could we make by selling vitamin C? Not very much. How much money do we make by selling vaccines and implementing them to the entire world's population starting at 1 day of age and giving flu vaccines to 6-month-old babies for every year for their entire life? How much money is to be made on that? Significant amounts of money. It's an industry. It's an industry with think tanks. It's an industry with government support. Natural holistic health doesn't have that. That the population is not being offered fair and balanced information, and they're not being offered alternatives that actually fortify their innate immune system and their overall health.
Were there specific events that challenged your personal views on vaccines?
Well, the evolution to where I am now started when I first met a population of school children who were totally unvaccinated. And I noticed that none of them were as sick as I was growing up, and none of them were as sick as the patients that I had tended to during my pediatric rotations. Their parents didn't expect their children to be that sick because they weren't that sick. So that was part of the beginning. But then when I was working in the hospital in 2009, in succession, I saw 3 patients brought into the hospital with fulminant acute kidney failure. I mean, they weren't making urine and they required immediate dialysis. And they had just weeks to months before had perfectly normal kidney function. 2 out of 3 of them volunteered to me that I was fine until I had that vaccine. I talked to the administration of the hospital because I thought they would want to know about this. But instead of wanting to know, they actively, rapidly refuted any potential correlation between the vaccine and the kidney failure, despite the fact that the nephrology kidney literature is full of case reports and potential mechanisms for how the components of vaccines and the intentional inflammation that's caused by vaccinations can either exacerbate underlying kidney problems or create new kidney problems and vasculitis, which affects the kidneys. The fact that the potential connection was denied by my colleagues and by the hospital administration necessitated me to start doing some research. And as I started researching just the influenza vaccine, a whole barrage of new information was available to me, not just on that vaccine, but on many other vaccines, on how vaccines are made, on the components, and on the absolute denial that vaccines have any downside by the medical profession. Because of that, I was really drawn into the history of vaccination. And then I started to discover that what we were told and what I had heard time and again by my colleagues in the hospital and by the hospital administration, which was the response to me about the flu vaccines, was that smallpox was eradicated by vaccination and polio was eradicated in the Western Hemisphere by vaccines. So what's my problem with vaccines? And at that point, I didn't have an answer to that question because I was never taught anything about smallpox and polio in medical school. But when I started to do the research and read the history books, both the pro-vaccine and the anti-vaccine literature, I was startled. First of all, because what was in those smallpox vaccines is absolutely disgusting. And even some of the most ardent pro-vaccine people today don't want to give smallpox vaccines to the population because they know how devastating that is to the immune system. They were vaccines that were loaded with animal matter and debris and that caused all sorts of secondary infections in people. Yet that is the one vaccine that's credited with the only eradication we've ever had. Isn't that strange? Well, when I dug deeper, I found that the most highly vaccinated populations for smallpox were the populations that developed some of the worst and most devastating and deadly smallpox epidemics. This is not something that you can even have a philosophy about. It's hard data that you can look at what the vaccination rates were in different towns throughout Europe, different countries and also in the United States, because we started taking data in the United States in 1900, and in the UK, in England, in 1838 they started gathering data. So we have data from back there. So we were able to actually see what the death rates were from certain diseases and what the vaccination rates were, especially with smallpox. And there is a correlation between the deadliest epidemics in the most highly vaccinated populations, and this happened in Japan, in Germany, in England, and the United States. That made me want to learn even more about smallpox and the smallpox history, which is what we wrote in our book. Polio was another one, because that's one of the vaccines that really scares people, because they don't want their kid ending up in one of those iron lungs or having a crippled limb like that. And I used to share that fear. However, when I started reading about polio, because I was told that, I should believe in vaccines because of smallpox and polio, it was unbelievable what the history of that vaccine is, what the history of what poliomyelitis really is, and how it's been defined over the years and how that's changed. It's incredible, and it's so contorted and complicated that it took me 70 pages of writing to just barely tell the beginning of the story. So the fact that these vaccines are what doctors use to uphold their belief today in vaccination, I think also needs to be critically looked at by these doctors that are upholding their vaccine belief based on that, because what we understand collectively is really not in line with what the history books and what the data show. Anytime I was consulted on a patient with kidney failure and any other drug was thought by me to be causing the kidney problem, be it a cholesterol medication, a high blood pressure medication, a pain pill, an antibiotic, all very common causes of kidney failure. Anytime I ever made that correlation, no questions asked, the drug was stopped, end of story. I was never considered a quack in my career. I was a highly respected nephrologist. I earned a good living, and I was teaching the entire time. Nobody ever had a problem with me ethically or philosophically. It was only until I started questioning the practice of vaccination that this occurred. And this happens with all sorts of credible scientists. Once they turn their backs on the practice of vaccination, we're automatically considered a quack, no matter whether we're Nobel Prize winners or not, no matter whether we're neurosurgeons, no matter whether we're successful obstetricians, doctors of chiropractic, PhDs in neuroscience, PhDs in biology, PhDs in immunology. These are all people that are out there now speaking against the practice of vaccination who are categorically, no questions asked, considered quacks. I think that should raise a red flag for people. And what I found is that when most people hear me speak and hear the pro-vaccine side speak, they're intelligent enough to make up their own mind.
What is our best defense against disease?
Well, as far as fortifying our own immune systems, I believe this begins probably generations before we're even born. Because there's a whole field now that's basically blossoming called epigenetics, which has to do with what's above the genome. It has to do with what our ancestors were exposed to, what kind of stresses they had, what they were eating, and what kind of disease susceptibilities we have. So we basically, what we do has an effect upon what our children's susceptibility will be. I think this is very pronounced during the period of pregnancy. And I'm very alarmed by the fact that pregnant women are now being recommended to get influenza vaccines and whooping cough vaccines, diphtheria, pertussis, tetanus vaccines while they're pregnant. I'm very alarmed by that because the immune system begins during pregnancy. In addition to that, once an infant is born, there's a whole process in the birth that has to do with the immune system. Human beings do something that no other animal does, and that is we immediately clamp the cord when the baby is being born. There's no other animal that does that. It actually doesn't make any biological sense. And what we're essentially doing is depriving that newborn baby of 1/3 of its blood volume, of stem cells that that baby needs. The placenta is packed with stem cells, and that's basically a stem cell transfusion. And scientists are just beginning to understand all of the other benefits of allowing that flow into the baby. This is the way humanity and all mammals were actually designed for the birth process. So why are we clamping the cord immediately? That needs to be questioned, because that has long-term effects as far as immunity goes onto children. It has effects onto anemia, stem cell transfusions, and basically those stem cells are able to go in and mop up damage that occurred. After the baby is born, should be put immediately to the breast, nothing in between. So the immune system begins going down the vaginal tract getting the first swallow of probiotics, a C-section deprives that baby of that beginning of immunity. There's so much that has to do with normal microbes that live in our bodies, and this is very important. I think one of the most important factors in our immunity that's leading people to believe that they need vaccines is that we are not cultivating the microbes that we need. We're not giving ourselves the probiotics that we need throughout life. We're deprived of them at birth. We're deprived of activated T cells, immune globulins, and probiotics that come through breast milk. A breastfed baby is completely different as far as what their stool component is to a formula-fed baby. Those things are very important foundations. So much that has to do with normal microbes that live in our bodies, and this is very important. I think one of the most important factors in our immunity that's leading people to believe that they need vaccines is that we are not cultivating the microbes that we need. We're not giving ourselves the probiotics that we need throughout life. We're deprived of them at birth. We're deprived of activated T cells, immune globulins, and probiotics that come through breast milk. A breastfed baby is completely different as far as what their stool component is to a formula-fed baby. Those things are very important foundations, and the foundations of anything, whether it's a building or whether it's a human being, are extremely important and much more important, in my opinion, than fighting disease with vaccines. And I'd really like to see more of a focus there and really educating parents and mothers as to why they should breastfeed and how long they should exclusively do it for. Because if they understood what they're giving those babies with that breast milk, they would be much more motivated to do it than just hearing, well, it's just better. And most doctors don't actually understand all the components that are in breast milk, and scientists are continuously discovering more benefits of breastfeeding. It has to do with higher IQs, lower type 1 diabetes, better immunity in the long run. So that's the foundation. After that has to do with nutrition. If a mother's eating poorly, her breast milk is not as high quality. If a child, when they start eating, is eating chemicals and high rates of sugar and carbohydrates and not enough fresh fruits and vegetables, their mitochondria aren't getting the power that they need to have to sustain an immune system. They're not getting the vitamins and the minerals that they need for good, strong bones and an immune system. Those things are very important. I think birth and nutrition, primarily the most important things. Then we have supplements. I like vitamin C because it's something that as mammals, as human beings, I should say, we don't make. Human beings, primates, and guinea pigs don't synthesize our own vitamin C. Even though we have the entire mechanism there, there's one gene for an enzyme that's defective. So we have to get that in our food. And because of the toxins and the viruses and the food that we're exposed to now and the levels of stress that most of us are exposed to, that consumes vitamin C. And because vitamin C is a necessary factor for immune function, we're all in need of it. There's no known toxic dose of vitamin C. There's never been a death from vitamin C. There are some mild potential downside to vitamin C in very high doses that people who are using it need to be aware of. But people need more education on the use of sodium ascorbate because I have firsthand experience with it in the pediatric population and how incredibly effective it is in calming the cough of whooping cough. I have had dozens of parents consult me because they had heard on the news how deadly whooping cough is. I've had anywhere from newborns up to 64-year-old people consulting me, terrified that they've developed whooping cough or that their children have developed whooping cough. The first thing I have to do is calm down their fear. The second thing I have to do is get them on high enough levels of sodium ascorbate. Within 24 to 48 hours, those parents are relaxed. The babies do fine. The toddlers do fine. Can anybody say that about an antibiotic? What do antibiotics do? They destroy the normal gut flora, which is part of our immune system, and that's another burgeoning arm of science, is how our gut flora is actually part and parcel with our immune system. Even that goes with the mother too. That the lining of the intestine in the mother is lined with these things called Peyer's patches, and they hypertrophy when she's breastfeeding because her body is taking what she's eating and the bacteria in her system into her system and out into the breast milk that educates that baby what's bacteria that's good and beneficial, what's disease and what's not, and basically educating that baby's thymus and their immune system. So the bacteria in our bodies, on our skin, in our throats, the proper balance of those bacteria in conjunction with a functional immune system is the best defense against any disease, period.